Hello and welcome to this situation report for Thunder Bay Regional Health Sciences Centre. My name is Maryanne Matthews and I'm here with Dr. Stuart Kennedy, the Incident Manager for our hospital's COVID-19 response. So hello Dr. Kennedy, how are you today?
I'm good, Maryanne. How are you?
I'm good, thanks.
Is Tracy taking another day off?
She is.
Okay.
Can you believe it?
Unbelievable. Yeah.
When
was your last day off?
I had last weekend off.
Oh, okay.
And
good.
I don't have to stay late like she does, so I think it's fair enough.
Okay.
I'll let it slide this
Okay.
time. So, Dr. Kennedy, what is our situation today?
So today we have, like yesterday, like the day before, we have 2 COVID-19 positive patients in our hospital. Both are not in ICU. They're in our 3A COVID unit. We are still waiting for a confirmative case to come back from Public Health Toronto because it was a weak positive, but we're treating it as positive. We have 18 presumptive cases, and we have our capacity in the hospital has creeped up a bit to about 72%, but we have a lot of capacity in the hospital to deal with any types of emergencies.
Okay, great. So yesterday, and this is something we've kind of talked about a few times now, but Premier Ford announced the details regarding the reopening and expansion of services that will be effective Tuesday, May 19th. Specifically noted were scheduled surgeries based on the ability to meet pre-specified conditions. So how does that affect our hospital, and does this change anything with regards to our plans and timelines for moving forward?
So we at Thunder Bay Regional Hospital have been moving forward with these plans probably in front of the rest of the province because of our small number of COVID-19 both patients and numbers in the community. I believe now I think we only have 3 to 4 active members in the community. We've been planning for elective surgery for quite some time. We've been held back, and rightly so, by the Ministry of Health because of making sure that we're in line with their recommendations. But we're ready to go, both from a community and from a physician perspective. We have to balance our PPE supply, our drug supply, our human resources supply, our test kit supply, but we meet all those numbers to move ahead. So we're just waiting for the official confirmation to move ahead. Our recovery team are presenting to the incident management structure on Wednesday, and we hope to have recommendations about when to initiate elective surgery here at Thunder Bay Regional Hospital. We'd have to submit that report to the Ministry of Health through Ontario Health North, and they will have to sort of sign off on it, but we're ready to go, and we need to move forward because there is a lot of pain and suffering going on in this community. And as I said before, elective surgery may be elective in our minds, but it's not elective for the patients waiting at home to have their hips replaced, their knees replaced, to have their gallbladders taken out. This is a high priority for us at this hospital, and we believe we're well positioned to move forward to take care of the other needs of the community, because if we do not, our backlog continues to increase, and that's going to be challenging over the next 6 months to a year.
Absolutely. So it sounds like that's welcome news that people hopefully will be pleased to hear, and it's great to know that our hospital is already on track with some of those requirements, or all of them it seems like. So in addition to the resumption of some surgeries, our hospital continues to work on our overall recovery plan. How is that going?
Yeah, we're getting, our team is meeting on a daily basis, led by Jessica Lagozo, and certainly with consultation with all our leaders, including our medical leaders. We're looking at when we can resume our sort of backlog of MRIs, our backlog of CAT scans, our backlog of all other procedures. We also have needed procedures in our ambulatory care unit and also in our endoscopy unit. So we're progressing in a methodological way that again balances PPE and drug supply to the needs of the population. So I can't comment a lot what's going to happen next week when we get that report back, but components of the report is going to be sort of outlined as we increase our services. We need a mechanism to decrease our services again rapidly if we have an influx of COVID-19. So that's why I appeal to the community again. That's important to maintain those principles of physical distancing and staying home, but I know those rules are going to be sort of eased up. But certainly, as the province eases up many of those rules, which I agree with, still you need to use common sense and keep that physical distancing so we prevent the spread of any disease here in Thunder Bay that's going to have an impact on our resources and the care we need to provide for all citizens here in Thunder Bay.
Another issue that we've heard come up somewhat within the recovery plan is the resumption of visitor restrictions. How will those be looked at as we move forward?
We know we have to revisit some of our difficult decisions regarding visitor restrictions on a weekly basis. And certainly for the long term, I think you're going to see significant visitor restrictions in place at Thunder Regional Hospital because it's a valuable infectious disease tool to have in place to prevent the spread of any infectious disease here at Thunder Bay Regional Hospital. We have learned a lot. But some of our other sort of restrictions were quite difficult for partners of families having children in the hospital, families where their loved ones is going through significant trauma or palliative care. So we need to revisit those policies, but I can really say for sure that we are not going to get back to the place we were. We have learned a lot from the visitors restrictions. We have learned a lot from not allowing our visitors to go out smoking. We have learned a lot for not having our patients wander around the hallways, and we need to maintain many of those restrictions for the longer term, but that will require review by our recovery team and make those recommendations. But we do need to ease up on some of our restrictions as we are more comfortable with the amount of community spread with COVID-19, which at this point in time is very, very little. And this also impacts what we need to recommend to the province. I think our value here in Northwestern Ontario has always been our isolation, and that's why we keep on encouraging to keep those borders closed to the United States for the foreseeable future, because once we enhance tourism and travel to and from the States, we also put our Thunder Bay residents at risk for COVID-19, and then we put our staff at the hospital at risk for bringing COVID-19 into the hospital. So we still have to be really cognizant of who we're allowing into the hospital, but I think a lot of those decisions are out of our control, but we can make strong recommendations to the province and the federal government.
Right, thank you. So it sounds like a balance between safety and patient and family-centered care. So it sounds like a lot of decisions need to be made.
Yes.
Thank you. So Dr. Kennedy, since the pandemic began, our emergency department experienced a decline in visits. Now as services begin to ramp up, we're starting to see those numbers rise again, but we know some people are still a little hesitant. So what should they know about needing to come to the emergency department for care?
So people coming to the emergency department for care will go through a screening process, and certainly they are all going to be treated as a potential carrier of COVID-19. So they're going to be entering our emergency department into a hot zone and a warm zone. All our employees are fully gowned and masked with gloves, so they definitely will not spread a sort of COVID-19 to a patient coming in. So it's a very safe department right now. If you've been to the emergency department before and come now, it'll be a totally different view of things. You're going to have sort of walls up. There's going to be one-way traffic to the hot zone and one way out of the hot zone. You're going to be accompanied by care providers to make sure you do not wander into another area. So I must say, as far as infection control, it's set up well, and the emergency department is very, very safe. But that also brings up some difficulties because we cannot handle the same volume we handled, when it was normal operations. Many times in the emergency department, we see 350 visitors to our emergency department a day. We cannot handle 350 visitors a day, so that's why we encourage individuals, if you have some minor problems, that you call the walk-in clinic or you visit your family doctor, because the volume certainly it needs to be decreased, so we keep those protective measures in place. But if you are ill, if you need our medical attention, we are there, and it's a safe place to come.
Absolutely. Thank you for clarifying that. And you touched upon if it's non-urgent to find alternative methods through clinics or family doctors. What about people who want sick notes? We're still not issuing those, correct?
We're not issuing them at all, and from my estimation, being a family doctor, I mean, a lot of the organizations should not even be requesting sick notes. We're not requesting sick notes here. I think even at the provincial level and the federal level, they're not requiring any sick notes because those are unnecessary visits. If you're sick, we want to see you. If you need to come for a note, we don't want to see you.
Perfect. Thank you so much. So thank you for clarifying all of that. Is there anything else you want to add today, or perhaps any words of advice for the community as we enter into the long weekend?
You know, it's a long weekend, and certainly I, like others, enjoy the May long weekend. But it's still very important that we keep our physical distancing. We're certainly, I know Premier Ford is relaxing some of the rules with golf, relaxing some of the rules with tennis, and rightly so. We need to actually get out and do some walking, do some exercise to keep our physical and mental health. But just keep the physical distancing. Wash, and wash your hands. No longer do you have to stay at home, but use a lot of common sense. And certainly enjoy the weekend. It's going to be a different weekend for most people. And certainly do not have the large gatherings. Okay, the large gatherings can be sort of an area or a convection for spread of any potential COVID-19. So we must keep our due diligence, but we can actually begin to relax some of the rules and use your common sense.
Okay, great. Thank you so much, Dr. Kennedy. Thank you, everyone, for tuning in, and have a safe long weekend.
Thank you.